Hi everyone, this is Dr. Lahari from Leo Dental, Bangalore. When a person undergo orthodontic treatment during his early teens or his teenage, and then after that orthodontic treatment, when the treatment is finished, the braces have been removed and they have went into a phase of retention period. After a few years, maybe 10 years or 12 years or 15 years, again the same problem tends to recur. This process is called relapse. So we see a lot of patients coming back like, ma'am, they will be around 30 to 35 and they come back, ma'am, I had an orthodontic treatment during my early teens and teenage. That time the teeth were very proper during the completion of the treatment. Again now my teeth are going back to their original position or the previous position before the orthodontic treatment. What can we do? So when you face a problem like this, that is the recurrence of the problem even after an orthodontic treatment, that becomes a very intriguing question for the people because of their age and other circumstances also. So when these people come to us, we counsel them, we explain them what has went wrong, and they can again go for a orthodontic treatment, repeating of the treatment, but this time it would be of a shorter duration. So when our orthodontic treatment goes into a relapse and an orthodontic or a regular problem comes again, there is nothing to feel bad or feel depressed about. You can actually go for a second phase of treatment and correct the regular into the positions, and then this time when you are educated enough and when you know what's going to happen without a proper retention, you can go for a permanent retention, and which helps you to continue the benefits of orthodontic treatment throughout your life. And sometimes, owing to your age and circumstances, if a regular orthodontic therapy cannot be done, line therapy is a very sophisticated treatment at disposal which can be very happily used in this recurrence patient. They can go for a line therapy so that nobody would be knowing that they are going through a therapy, but still their malocclusion can be corrected. In cases of recurrence of irregularities or recurrence or relapse of the orthodontic treatment, line therapy is a wonderful procedure that will actually correct the discrepancies in a very shorter period, and that would be done without disturbing the normal life of the patient. So whenever a relapse is seen in orthodontic treatment, there is nothing to dishearten. You have always got a second chance to correct yourself. See an orthodontist, explain your problem, seek treatment, and once again you have all rights to own a beautiful smile.